Okay, let me invite one of our group members, one of the facilitators that I can see from here, Pharmacist Ngozi Okeapo. Please give us an opening prayer if you are with us. Just unmute yourself.
Good evening, everyone. Can you hear me, please? Hello?
Yes, we can hear you.
Yeah, we can hear you.
Good evening. You're welcome to today's program. Let us pray. Thank God, Almighty Father, for the gift of this day. As we deliberate on this topic today, may we learn things that will help us to serve humanity better. Amen.
Thank you very much. Our next on the agenda is, we'd like to start by specially recognizing the drug information training coordinators, ably led by Pharmacist Folashade Lawal, FPCPharm. Now we welcome you to this very important training session.
Thank you, sir.
The entire members of the coordinating team, specifically Dr. Ibrahim Bello, for his tireless efforts to bring everybody to their toes for this training to be a sustainable one. Thank you very much, and all other members of the coordinating team. I also wish to recognize the members of the facilitating team, for which I am a member, our speaker, and other members who are here present. We welcome you to this very important session. I wish to recognize all fellows of the Pharmaceutical Society of Nigeria, all fellows of the West African Postgraduate College of Pharmacists, our professors here present, our lecturers, heads of departments, all important dignitaries, and of course, all our distinguished participants. At this juncture, I wouldn't want to take us too long. Our today's topic is going to be ethical aspects of drug information. As we can all see, as we all know, this is a special session after going through the rigors of the basic information for several weeks. I think the last presentation, we also saw the legal angle of the drug information. And today we are going to look at the ethical angle. One way or the other, they are somehow related, but they are not the same. So it is important we understand the legal perspective and at the same time, the ethical perspective for us to be able to differentiate. So our speaker for today is no other person than Pharmacist Dr. Bukola, Pharmacist Folorunso Oluwatoyin Bukola. Bukola is a seasoned community pharmacist who has a passion for research. She obtained her Bachelor of Pharmacy from Obafemi Awolowo University, a PharmD degree from University of Benin, and a master's degree in clinical pharmacy from University of Lagos. She is also a fellow of the West African Postgraduate College of Pharmacists. She is the director of Healthmaps Pharmacy Limited Lagos, a community pharmacy that has been in active practice for the past 16 years. Bukola is the immediate past chairperson of the Drug Information Center of the Association of Community Pharmacists of Nigeria. She is also the immediate past editor of 2 publications of the Drug Information Center of ACPN, namely Association of Community Pharmacists of Nigeria Drug Bulletin and You and Your Pharmacist, a position she held for 4 years. Pharmacist Bukola has a passion for knowledge and research. Ladies and gentlemen, at this point in time, I would like to invite our speaker for today to kickstart our presentation. Pharmacist Bukola, the floor is yours.
Okay, we are going straight into the lecture, which says ethical aspects of drug information. This is the overview. We are going to talk about what is ethics, characteristics of ethical deliberations, levels of ethical decision-making, the ethical rules, principles, and theories that apply, examples of ethical dilemmas, and resources to guide ethical decision-making. Okay, so what is ethics? Ethics, according to the ethics course content of the Committee of the American College of Pharmacy, ethics is described as the philosophical inquiry of the moral dimension of human conduct, that is, the morals of human behavior. Now, ethics is from the Greek term ethos, which means custom, conduct, or character. Now, ethics has to do with concrete judgment in situations in which action must be taken despite uncertainty. The one that comes readily to mind is the issue that went viral about a pharmacist that dispensed methotrexate in a situation that seems like an ethical dilemma. Recently, I think maybe we can recollect that. It went viral and it led to a lot of issues. That's an example of an ethical situation which we can face as pharmacists. It is often used synonymously with the term moral to describe an action or decision as good or bad. What are the characteristics of ethical deliberation? Ethical deliberation is ultimate or fundamental. That is, there is no higher standard against which you can measure what the rightness of the decision or the action. You cannot really measure it against any standard. The issue is also universal, which means the party involved believe that there is a right or wrong answer, not just a difference of opinion. But this party may disagree about what the answer is. It's not just that is what is right with me may be wrong with you, what is wrong with me may be right with me. That is when you say there's an ethical situation. And the deliberation takes into account the welfare of all those that are involved or affected by the judgment at hand. It takes into account the patient, the pharmacist, the prescriber, the family, the hospital, and even in society at large. That is an ethical deliberation. What are the levels of ethical judgment? Ethical judgment may occur at three levels of healthcare decision making. We have the micro level. The micro level of healthcare decision making involves decision being made at the individual, professional, patient level of healthcare. That is, it has to do with an individual professional and a patient. An example, a pharmacist is asked to provide information that might be used to speed the ending of a terminal patient's life. This may seem absurd, but these are the kind of things that we might encounter as pharmacists. And it's a micro level healthcare decision making because it has to do with an individual professional, a pharmacist, and then a patient. Meso level, that's the second level of healthcare decision making. Ethical decisions that occur at the institutional or organizational level or at the community or regional level. It has to do with an organization. Example, a pharmacist may face an ethical dilemma when he's participating in a pharmacy or therapeutics committee regarding the use of pharmaceutical samples within the hospital. May face a dilemma as to whether should we use pharmaceutical samples or can we use approved drugs. That may be an ethical situation or dilemma. Another example is ethical decision on the use of in-house professionals versus industry detailers to provide information about new drugs. There may be an ethical situation, a situation of uncertainty. You may think that industry detailers may be biased, whereas you may also think that in-house professionals may not have enough knowledge about the new drug product. So that is an ethical situation where a decision has to be taken. The third level of healthcare ethical decision-making is at the policy level of healthcare system. It occurs at the level of establishing standards for the entire profession through the government as regulation for the society as a whole. It has to do with the policy level. An example, participating in a national task force charged with developing policy related to medication therapy management may involve taking decisions relating to balancing the patient's needs, the professional identity, that is constraints. That is an example of a macro level ethical decision making at the policy level. We have to note that professional ethics is different from the law. We spoke about law a lot last week, so I'm not just going to go over law or what law is, but we should realize that law represents one aspect of culture within which ethical decisions are made. That is, relevant legal requirements must be identified and considered when you want to make an ethical decision. This slide talks about the difference between law and ethics. I'm going to look at points 1 and point 4. Law involves written rules. Laws are written, laws are stated. Ethics focus on implicit rules, not clearly defined, not clearly stated, or maybe explicit rules and standards. And then the point 4 says that certain ethical standards of a given profession may be institutionalized as law by the society as a whole. There are some ethical standards that the society may decide to institutionalize as law, but professional ethical standards are often impossible to fully regulate by law. You cannot entirely regulate ethics. You cannot regulate ethics by law. So I go on. Now let's look at this and consider it. It's a little quiz which we answer in our minds ourselves. Identify what level of ethical decision making these examples belong to. A, the community pharmacist or hospital pharmacist is requested by the patient to critique another healthcare professional drug therapy recommendation. That would be a micro level ethical decision making because it has to do with an individual pharmacist and is requested to critique another healthcare provider's therapy recommendation. That's an ethical, micro level ethical decision making. B, the pharmacist is asked to tell the patient significant other that the administered medication is for other than the STI being treated. That's also a micro level decision making, ethical decision making, because it involves an individual pharmacist and a patient. And then there's a situation where there's an uncertainty and you have to take an action or make a judgment. Another one, the industrial pharmacist, who is asked to prepare a consumer product education and promotion piece according to directions that do not adhere to WHO guidelines for balanced presentation of both benefits and risks associated with the drug product being advertised. That would be a meso level decision making because it has to do with an organization. Another example, the pharmacist enrolled by a professional organization to testify against a proposed health reform policy that mandates pharmacists to provide follow-up phone call and verbal drug information to patients on multiple drugs to monitor for adverse effects through interactions without pay. That has to do with policy. And then the pharmacist has to take a decision on that. This is a macro level decision making because it has to do with policy. Let's go on. When faced with an ethical situation, what do we do? These are the terms that we use when there's an ethical deliberation involved. Rules, principles, and ethical theories. Rules and principles are action guides utilized to justify a particular judgment. Rules are specific to a content and they are relatively restricted in scope. That is, or example, rule of confidentiality addresses a patient's right to consent prior to the release of a privileged information. It's specific to a particular information. Principles are broader and fundamental in scope. There are 4 major bioethical principles in healthcare. We have principle of autonomy, principle of non-maleficence, principle of beneficence, and principle of justice. We are going to elaborate on them as we go on in the lecture. What are theories? Theories are integrated bodies of principles and rules that govern cases of conflict. When we are faced with a situation that is conflict, there are 2 broad theories that govern ethical decision-making by healthcare professionals. we have the consequentialist theory, and we have the deontological theory. What's the consequentialist theory? It describes an action or a decision as morally right or wrong based on their consequence, rather than on any intrinsic features they may have. It looks at the end, it looks at the outcome, and any decision is judged as right or wrong based on the consequence. That is, the end justifies the means. That's what consequentialist theory is all about. The second one is the deontological theory. It looks more at the intrinsic quality of an act or a decision to assert its moral rightness or wrongness. That is, it looks at the means instead of the end. That is, the means justify the end. Consequentialist theory is the end justifies the means. Deontological theory means the means justifies the end. Under the deontological theory, an act is considered wrong if it is dishonest, or if it breaks confidentiality, or if it does not respect individual autonomy. Now let's look at the consequentialist theory. Under the consequentialist theory, there are two cardinal principles. Under this theory, we have principle of beneficence, which means do that which promotes good outcome. Whatever you do that will bring a good outcome is right under the principle of beneficence. This means doing what is best for the patient. If you have to withhold an information so as to have good outcome, is right under the principle of beneficence. That's what it means. If you have to withhold telling the patient the side effect of a drug, is right once you think that it will bring about good outcome under the beneficence principle. Under the principle of non-maleficence, do that which minimizes bad outcome. Whatever you think may result in bad outcome, then you will do it under the principle of non-maleficence. This could be a justification for acts and omissions. For example, you could withdraw treatment if you feel that it's not benefiting the patient. You could actually, you may not tell the patient the side effect of the drug if you feel that it will lead to non-adherence, that is bad outcome. When in conflict, non-maleficence, do that which minimizes good outcomes. Do that which minimizes bad outcomes, supersede the principle of beneficence. Rules considered under the consequentialist theory, provided it will lead to good outcome. You know, we are looking at the end under consequentialist theory. So all these rules will only apply if it will lead to a good outcome. Fidelity and reciprocity, if it will lead to a good outcome. That is, trustworthiness, keeping promise, consideration of others' points of view, only if it will lead to a good outcome. Respecting the patient-professional relationship to the extent only that it will lead to a good outcome. We are going to look at the deontological theory. Under the deontological theory, the rules and principles that apply are autonomy principle. That's individuals' right to self-rule and decide on issues that primarily affect self. The patient has a right to decide on what affects him. A competent adult informed decision to refuse even a life-saving treatment supersedes the offer of treatment. That is under the autonomy principle, which is one of the principles that operates under the deontological theory. We have justice principle, that is fairness and treasuring what is right, and it's often cited as a justification for a particular decision under the meso and macro level. Other rules are consent rule, the right of the patient to be informed and freely choose a course of action, confidentiality rule, right to give and receive consent relative to the release of privileged information. Privacy rule, that is the right of the individual to keep information to himself. For example, the rights of individual with AIDS versus those of their sexual contact. Individuals with AIDS may choose not to tell their sexual contact that they have AIDS. That's under the privacy rule, which is one of the rules that operates under the deontological theory. Respect of persons, veracity, fidelity and reciprocity, and respecting the patient-professional relationship are the rules that work under the deontological theory. Now, when faced with an ethical dilemma, what do? What are the processes involved in the analysis of an ethical dilemma? The first step involved in analyzing an ethical dilemma is identification of the relevant background information. This involves the factual details of the issue at hand, consideration of who is affected by this ethical issue, learning and respectfully addressing the cultural perspective, including the legal requirement for all those that are affected by the dilemma. That is the first step you have to take when you are faced with an ethical dilemma. For example, now does the parent who calls to ask about the medication recently prescribed for a teenage daughter know that the teenage is on birth control pills prescribed by a gynecologist rather than a dermatologist for acne, and simply wants to know the name of the product? You are faced with an ethical dilemma. A parent calls you and asks you, what is the name of that medication that's been prescribed for my daughter for acne? And when you look at that drug, it's not for acne, it's actually a birth control pill. You have to identify what are the facts here, who are those affected, what are the cultural perspectives involved. The fact here is that the teenage is under a parent and is still a minor. That is the fact. The fact is that the teenage daughter is now on birth control pills. Another fact is that the parent is unaware that the daughter is on birth control pills. Another fact is that the daughter saw a gynecologist rather than a dermatologist. Those are the facts that are here. And another fact is that the parents want to know the name of the drug that's been given to the teenager. And another fact here is that you are now faced with an ethical dilemma. So what do? Who are those affected in this example? The teenage daughter is affected, the parent is affected, the boyfriend or the partner is affected, the dermatologist is affected, the gynecologist is affected, even the hospital management is affected, even you, the pharmacist, you are affected. What are the cultural perspectives involved? In the culture where the parents reside, is it considered right for a teenage to be on birth control pills? That is one of the cultural perspectives involved. The legal perspective is also involved in this case. Is it legally right for a minor to be given a medication that the parent is unaware of? These are the legal implications that comes under the cultural perspective, and you have to look at all this. The second step when you are analyzing an ethical dilemma will be the identification and justification of the relevant moral rules and principles that are pertinent to the case. You have to identify the rules that apply under this case. When you have analyzed the background information, if the dilemma persists, then the moral rules and ethical principles should be assessed within the accepted ethical theory. What does that mean? We have said that there are two ethical theories, consequentialist theory and the deontological theory. You have to accept one. You have to decide which of you want to take. Do you want to go with the consequentialist theory, or do you want to go with the deontological to look at the principles, the moral rules and ethical principles that operate under the theory that you have accepted as the professional? Moral rules and ethical principle considered will include confidentiality rule, informed consent, veracity, obligation to tell the truth, that fidelity, and justice. In some instances, moral rules and ethical principles may conflict. For example, in this case that we are looking at, obligation to tell the truth always. That is when the parent asks you, that's veracity, to tell the truth always, may now conflict with fidelity. Fidelity is to keep the trust. Do you want to keep the trust of the teenage daughter, or do you want to tell the truth? So there's a conflict in this case. We are still looking at the process of ethical dilemma. When you realize that you are faced with a conflict, ethical theory is the means to clarify rules or principles. The professional may resolve the dilemma through his or her moral intuition of the right thing to do. And the right thing to do is often a reflection of our own temporary affiliation to some theory of good or bad. Depending on your own moral values now, you can now cling to a theory of what is good or bad, and then use that theory to analyze the ethical dilemma that you have faced. Let's look at another example. Mrs. Sade is an 8-week pregnant woman, and she has been prescribed metronidazole by Dr. Eze. Dr. Eze is a new physician in your facility. She's concerned about whether she should take the medication and approaches the drug information specialist, which is you now, with the question, is this medication safe for my baby? What do you now do? 1, you have to identify the relevant background information. 1, Mrs. Ade is 8 weeks pregnant. 2, she's been treated for a recent vaginal infection. 3, she's seen Dr. Eze for the first time. So she's still looking at Dr. Eze. That's one of the facts. 4, Dr. Eze is aware of her pregnancy. You may need to consult professional resource to evaluate whether the therapy appears appropriate. 1, you may need a reasonable period of time to investigate the pertinent information before providing an answer. You may decide that further facts must be obtained through direct discussion with Dr. Eze. Now, you have to identify those who may be affected by this ethical issue. Mrs. Ade will be affected. Mrs. Ade's unborn infant will be affected. The pharmacist, you will be affected. Dr. Eze will be affected. Mr. Ade and other family members may be affected. Even the hospital management may be affected depending on the decision taken. The welfare of all those I've listed above must be considered. And then the cultural perspective of all the parties too must be considered. The pharmacist's legal obligations, you must consider it. Your cultural and religious perspective, you must consider. Also, perspective regarding the parental responsibilities for an unborn child must be considered. Perspective and legal requirements about the role and authority of the physician, you must consider. Another thing you have to put in consideration is the level of decision making. In this case of Mrs. Ade, the level of decision making involved appeared to be micro, but ethical dilemmas tend to have implications beyond the contents of just 2 individuals. I still cite the example of the online example that went viral of the pharmacist that dispensed methotrexate. Initially, if you have to consider the level of decision making under that scenario, it appeared as if it was a micro level decision making, but micro level ethical decision making can snowball and become meso and even micro, as we witnessed in that case, leading to policy changes and all that. That's why we have to consider all these things carefully. The pharmacist also may have obligations to the pharmacy and therapeutics committee within the health organization, or perhaps even beyond, as policy committee member for his or a national professional organization. That is, micro level decision making may snowball and even become macro level decision making. Now let's look at Mr. Ade's case in detail. We want to identify and justify the relevant rules and principles. One rule is informed consent. Now, Mrs. Ade has a right to be informed of the risks and benefits of metronidazole in early pregnancy, and to freely choose whether to take it in relation to other options. Another one, respect for patient-professional relationship. The pharmacist has a duty to respect the professional relationship between Dr. Eze and Mrs. Ade. It's not for the pharmacist to say, no, that doctor does not know what to say. You must respect the patient-professional relationship as well as between you, the pharmacist, and the patient. However, realize the pharmacist's obligation to the patient is primary. Other rules are veracity, obligation to tell the truth. If you want to use the deontological theory, you have obligation to tell the truth. But if you are using the consequentialist theory, you say the truth, you apply veracity only to the extent that it promotes good outcome. If it does not promote good outcome, then under the consequentialist theory, you have to know what to do. 4, another rule that you look at is non-maleficence. Decision to divulge information will be based on doing no harm. 5, beneficence. Divulge information based on the potential to do good. Those 2 are consequentialist theory. Justice principle. Mrs. Ade's entitlement to information may be considered justice in this case. Autonomy principle. believe in Mrs. Ade's right to decide on issues that primarily affect her. These are the rules that we may consider under this ethical dilemma. Now, application of these principles is often complicated in medical ethics. How do we balance these rules and principles? Non-maleficence and beneficence, that's consequentialist theory, must be weighed or balanced against autonomy and justice, which is deontological theory. And then you must decide which of the theory you want to follow. The fundamental principle supports honest discussion of the benefits and risks to the patient. However, if there are no good alternative therapy, non-adherence may constitute a greater risk. Consideration of the fact of this case, those affected, the cultural to legal perspective, relevant rules and principles, personal belief and value will lead to an ultimate ethical decision. Note, there is no universal agreement as to what constitutes the right resolution of an ethical dilemma. So I'm not going to tell you this what should be done, this what should not be done. You have to decide which of the theories you want to follow and what steps you have to take. An ethical issue is defined as one where most agree that there is a right answer, but cannot always agree on what the answer is. And then that takes me to this, which describes ethics. If you look from this side, it's 6. If you look from this side, it's 9. So just because you are right does not mean I'm wrong. You just haven't seen seen life from my side. And that's what ethics is all about. I'm going to leave with this case study. Now there's a patient that doesn't speak English and is receiving chemotherapy at the hospital. Our family members translate to her what the hospital says. You tell the family that this particular chemo can cause hair loss as a side effect. The family decide not to tell the patient this information since they know it will upset her. The patient has to sign the consent form for the chemo. Now you are faced with an ethical dilemma. Do you tell the patient or you follow the family's good intentions? The issues that should be considered are consent, truth-telling, confidentiality, and then you have to decide what you have to do. Resources to guide us when making an ethical decision. Pharmacists need training, resources, and support to effectively address the ethical dilemma we confront. We must learn to recognize opportunities for ethical deliberation when they arise. Formal coursework, in-service training or education, or continuing education can teach skills that we aid in handling ethical dilemma. I have put some resources here that we may look up to see issues on ethical dilemma, how to resolve them. We can go through them in this slide later. Now, formal organization structures that support and guide pharmacists when faithful of such structures are ethics committee, policies and procedures to support and inform in ethical analysis and decision making. In conclusion, pharmacists will always be called on to provide drug information. We will sometimes encounter ethical dilemma regarding what information to provide. We must be prepared to analyze the situation, balance the pertinent rule and principle, recognize our responsibilities to the client and other individuals involved and the society as a whole, study and rehearsal of important analytical steps that we have gone through will go a long way to prepare us to address ethical dilemmas. And then that is the end. Thank you very much. These are my references. Thank you. Thank you, Andrew.
Thank you very much. Yes, thank you very much. This is Pharmacist Folorunso Oluwatoyin Bukola. I think with the way she presented, she has already shown to us that she's really an expert in drug information. You believe me that to bring such a presentation in a very complex topic like this, presenting a topic as complex as ethical aspect is not easy at all. For someone to dissect this topic of time, giving us a lot of case studies and a lot of references is not easy. So therefore, we must applaud Pharmacist Bukola for this wonderful job. Thank you very much.
Thank you.
I want to say that this is actually a unique presentation. If you all agree with me, and the information are much, just like I said during my opening remarks, or during the opening session, that we have seen a lot of other aspects of drug information, mainly dealing with the content of the information we give out and we are giving out. And by looking at the legal aspects, we also looked at the law. And coming back here, we are looking at ethics. This is to tell you it is not just about the information you give out. It is not just about how correct the dose you are able to provide of the drug, how you are able to evaluate literature. You can see the complexity, especially when you are confronted with what we call dilemma. When you talk about dilemma, it means you have more than one options, and those options are very, very critical. And what she presented to us is just to talk about when you are presented with those options, it means there is need to deliberate. If you deliberate enough, then you have to take a decision. When decisions are taken, then you have to pass judgment. That judgment you pass will have implications. And for you to have positive implications before passing the judgment, there are rules and theories guiding those judgments, which she has explicitly itemized. And I want to believe the case studies she has brought a lot of light to this. So I think the presentation was so concise that it has not even taken much of our time. So at this point in time, I would like us to use the next 10 to 15 minutes to have questions, answers, and observations regarding the presentation so that we can just close for today's session of the training. Thank you very much. So please, the floor is now open. Questions, answers, observations, and questions, answers, and comments. We're expecting hands to be raised.
Okay.
Can you stop sharing your slides? Can you stop sharing your slides?
All right. I've done that. Okay.
We don't seem to have anybody raising hand. And we don't seem to have anybody raising hand for questions, answers. I can see from the chat board, we have people bringing out a lot of comments. Suleiman Ademola saying thanks for the well-thought information. Thank you, thank you. We have somebody without name saying thank you. Please, can we have the presentation slides that we are going to send later? I have one of the coordinators also, Pharmacist Rupeya, telling us thank you for this wonderful presentation. We also have Ngozi saying thank you for this informative presentation. So we are still expecting one or two comments from members as Pharmacist Bukola is all ears to attend to all concerns.
Hello.
Hello.
Yeah. Yes.
My name is Suleiman Ademola.
Okay. Go ahead.
I first of all want to thank my classmates for the wonderful presentation. Thank you so much.
It's good to hear your voice.
And secondly, and most importantly, I also want to say that the major issues we are having as professionals is the inability to apply the ethical principles when we are faced with the ethical dilemmas, because these are things that we come across day-to-day activity, not only in our professional, but even as an individual. You agree with me that we always have this thing between two pharmacists and other professionals, pharmacists and a place of work, pharmacists and the government policy. And I think that it is an aspect that we actually do not understand at all. To me, if there is an area that Pharmacy Council in the program they always do, continue education, if this is given quite attention, I can assure you that most of the problems we are facing, pharmacists will make a statement, another pharmacist will make another statement, and you begin to wonder which of the tool is the ethics of the pharmacy, who is actually saying the truth, whether in the hospital or even talking to the media. And yes, it's an area that is really not popular, but it's an area that defines us as pharmacists. So you have actually done a good job, but my fear is that very, very few percentage of pharmacists actually will have opportunity to this. It is a presentation that's supposed to be presented at a place like PSN National Conference or to the Pharmacist Council, that the people should pay to come and see how they should talk, how they should behave within their colleagues, with other professionals, with the patients, and even with the organization where you work with. So once again, thank you so much.
Thank you.
Thank you, Pharmacist Suleiman Ademola. So any other comments? There is a question here on the chat box from Pharmacist Mohammed Ahmad Suleiman. Thank you for the presentation. And the question is, when pharmacists are confronted with this dilemma with regards to drug information, do pharmacists have a guide to follow before reaching a conclusion? So Pharmacist Bukola, even though probably Suleiman joined late, but you can hear the question. That are there guides for someone to follow?
Yes, there are guides, and I think that's what the lecture is all about. We went through the guides, the theories, the rules that you follow that actually give you a direction of what you're supposed to do when you are faced with an ethical dilemma. Maybe you go through the slide, you will see the theories there, you see the rules there, you see the principles that you have to follow when you are faced with an ethical dilemma. You have to take your time. Don't just rush in and then give a decision and thereafter you begin to say, oh, maybe that's not what I should have done. But when you follow the principle and you decide what you want to do, then that will be the guide that you follow. I don't know if I've answered the question. Hello?
Yeah, it's okay. There's even another question. This one
Hello?
is, can you hear us? Can you hear us?
Yes, I can.
Are you there?
Yes, I'm there.
Yeah, so there is another question. Let me see. In situations where there is conflicts, in situations of conflicts between, when taking decision where you have conflicts such as cultural and government policies, does the law back you up, especially where there is no right or wrong answer?
If you look at the
Can you
slide,
hear this one?
yes, I heard it. If you look at the slide, towards the end, I said formal structures need to be put in place, like ethical committees that will guide, that will give guides. And we support pharmacists when they take ethical decisions in which there are implicit and there are no clear cut answers, and you have to take decision and it's beyond legal requirement. So maybe the regulators or each institution needs to have some form of formal structures in place, like ethics committee in an hospital that will actually give a little guide as to what to do, just the way we have said it here, to train the pharmacist that's on duty. This is the steps you have to follow when you are faced with an ethical decision. And as per, ethics is different from the law. It's actually impossible to fully satisfy the law requirement that has to do with ethics. That's why ethics is different from the law. What you have to do is to decide the theory you want to follow and follow it. And then there should be structures in place in the hospital that can actually guide and that you can report to on what decisions you have taken. Are you hearing me?
Yes. We can hear you. I think the person that asked the question.
Yeah.
Go ahead. Yes. Any more questions, observations? Yeah.
Hello, sir.
Go ahead. Go ahead.
Hello.
Hello.
Go on.
Yes, go on.
Yes, we can hear you. Who is talking?
Sorry, please, I want to just add a little that it is important
Okay.
for us to know that where there seems to be conflict between the ethics and the law, we must at all time, no matter how we seems to see the other side to be right, we must stick to the law. Because as far as the law is it is defined, the law is all about this is the consequence if you do this, and it has its punishment. So but ethics may not. You may only be scolded for what you have done. But in terms of the law, if the person that is aggrieved decide to go further, you will go for it. So where there is a clear definition in the law, no matter how good that thing looks like to you ethically, you must hold on to the law, because even the ethical committee will not be able to protect you in that manner. And I think that is one of the things that pharmacy law and ethics should be thoroughly not only taught while in school, but even in our various sub-organizations. It should be one of the things that we must always hammer on, so that our members can be adequately protected. Thank you.
Yes, thank you. It's one of the things you must consider before you take decision. You know, the legal requirement is under the cultural perspective. It's together with the cultural perspective. So relevant legal requirements must be considered before you take a decision in ethics. It's just that there are some things that the law is not clear on, and you still have to take a decision. Thank you.
That's true. And to add to that, it is very important to know that this is a very critical decision, and depending on the type of law in the country of practice, sometimes some of the examples I've come across in the lecture, the whole lecture, is that sometimes the ethics may lead to what they call civil disobedience. Look at a case scenario of a pharmacist who was asked to dispense a poisonous drug to be used in sentencing a prisoner to death. And this sentencing was given out by a competent court of law. So this is a very critical dilemma. Dispensing that drug is unethical, while the law says this guy should be executed. So probably in a country where they use this particular method to execute, so they believe sometimes the ethics might lead to what they call civil disobedience. And it is also accepted. Thank you. So I think we are almost through. This is 10 o'clock. And we just have to call it a day at this juncture. I think there are no more comments or questions coming up. So at this point in time, we'd like to specially thank Pharmacist Folorunso Oluwatoyin Bukola for this very good and wonderful presentation.
Thank you.
And we'd like to invite the lead coordinator for the drug information training to give us her closing remarks in the person of Pharmacist Folashade Olawal, FPSN. Ma, you're welcome to the floor.
Thank you, Dr. Folorunso. That was great. And you kept us all glued to the slides. Thank you, everyone, for being part of this. It was a great learning experience for all of us. Thank you, and God bless you.
Thank you, ma.
Thank you, Pharmacist Folashade Olawal. And I think at this point in time, we have come to the end of today's drug information session. And I would like to use this opportunity to invite all of us to pray in our individual faith for the next 30 seconds for us to close. Let us pray. Thank you,